Thank you, Allie. As Allie mentioned, I'm the project director for the Indiana Healthy Families Alliance, or IHFA. I am joined today by two of our team's project coordinators, Bryce and Collette. Collette is one of the IHFA's original team members. She has been with IRHA since 2019 and has served as a project coordinator since IHFA's inception. I'm probably going to embarrass her here a little bit, but I wanted to share a little story about Collette. When I was first hired a few months after her, my primary role as a seasoned navigator, which is a nice word for old, was to help support and train IHFA's new program navigators. Collette had just recently obtained her navigator license, and I was observing her working directly with a client. And I remember thinking to myself, oh, she's going to be really good at this. And I was right. She has this incredible gift of making people feel so comfortable, and she builds this trust with her families, and they absolutely love her. Her office is in Washington, Indiana, and when I visit her there and we walk down the sidewalk to go to lunch, I feel like I am literally a celebrity because so many people stop and thank her for all that she's done. It's pretty incredible. Bryce is joining us once again for our third consecutive Lunch and Learn. But I don't think I've ever really taken an opportunity to provide his background, so I'd like to take that minute to do so. So Bryce joined IRHA in 2018, and he currently serves the IHFA team as a program coordinator. In addition, he serves as the program director for IRHA's Mommy Wise program. Mommy Wise is a 2-year initiative funded by the Indiana Department of Health that focuses on improving the infant mortality rate in Grant County. He and his Mommy Wise team work with community educators and subject matter experts to provide education and support on topics related to maternal and infant health in Grant County. In addition to his current work, Bryce has extensive experience supporting rural healthcare initiatives across Indiana. He has worked to expand telehealth access in rural communities, supported school-based telehealth programs, managed healthcare data systems, and over the years has contributed to numerous IRHA projects and program development efforts. One of the things I appreciate most about Bryce, and the reason he continues to sit beside me for these lunch and learns, is his ability to take complex information and make it feel easy to understand, which again makes him a perfect fit for today's topic and for the IHFA team. So now let's take a closer look at the Indiana Healthy Families Alliance and the work we do. IHFA is a statewide program led by the Indiana Rural Health Association. Again, I mentioned it was established in 2019. IRHA is the sole Indiana grantee funded through the Centers for Medicaid and Medicare Services, or CMS, and we have been selected for 3 consecutive terms based on our success and ability to provide outreach, education, and enrollment assistance related to Medicaid and the Children's Health Insurance Program, or CHIP. Our primary goal is to identify uninsured children eligible for Medicaid or CHIP, and our team is comprised of licensed navigators and subject matter experts who help families understand their health coverage options, complete applications, and successfully enroll and renew coverage in programs like HIP and the Hoosier HealthWise. A big part of that work includes helping individuals understand the notices they receive from FSSA, which is exactly what we'll be focusing on today. So whether you are someone working directly with individuals and families on the front lines who may have questions about FSSA notices, or whether these notices apply to you personally, we hope by the end of today's session you feel more confident understanding what these notices mean and what steps may need to be taken when receiving mail from FSSA. We will discuss the role that FSSA plays in Medicaid and CHIP, eligibility and communications, review some of the most common types of notices families receive, and discuss how to identify important information such as deadlines, requests for information, and next steps. We'll also review resources available to help families navigate coverage issues and explain how our IHFA navigators and community partners can work together to help prevent delays, denials, and unnecessary gaps in coverage. If you've joined us for past Lunch and Learn services, you may remember that we typically do more of a conversational question and answer style presentation. But because we do have a lot to get through today, we decided it would be more helpful to break the presentation down into parts. We hope that even though we have a lot to get through, that you still find our delivery practical and personal. If you have questions throughout the presentation, as Ali mentioned, we're going to ask that you hold those until the end so we can make sure we get through all of today's material, and then we'll be happy to take those before our time is up. So at this time, I'm going to turn things over to Bryce, who will begin part one of today's presentation, Understanding FSSA's Role in Health Coverage.
Well, thank you, Anne. I really appreciate that. And thank you for the kind words. It is a joy to be able to do these lunch and learns with you. So to start us off today, I think it's very important to understand the role that FSSA plays in health coverage and why individuals receive so many notices from that agency. FSSA, which stands for the Family and Social Services Administration, is the state agency responsible for administering many public assistance and health coverage programs throughout Indiana. So this includes programs like Medicaid, CHIP, SNAP, and TANF. When someone applies for coverage, renews coverage, reports a change, or submits verification documents, FSSA is going to be the agency responsible for reviewing that information and determining eligibility. FSSA is also responsible for communicating important updates and decisions through official notices. Those notices may include approvals, denials, requests for information, renewal reminders, or changes to benefits and eligibility. Understanding that FSSA is essentially the central agency managing these processes helps explain why these notices are so important and why responding to them in a timely manner can directly impact a person's coverage. Again, here's a list of some of the more common programs that FSSA oversees eligibility for and that many in our audience may recognize. Even though these programs may serve different populations, they all rely on FSSA to determine eligibility, process applications and renewals, review changes, and send notices related to coverage or benefits. So that's why individuals may receive multiple notices from FSSA at the same time, especially if more than one person in the household is receiving benefits or participating in different programs. Now, one thing that can sometimes be confusing is hearing both the terms FSSA and DFR used interchangeably, right? So the reason for that is because DFR, or the Division of Family Resources, is actually a division within FSSA. So while FSSA oversees Indiana's public assistance programs as a whole, DFR is the part of the agency that works more directly with applications, renewals, eligibility determinations, and case processing. So to explain that in the most simple way, FSSA is the overseer of public assistance programs, and DFR is the one that's processing the applications, the renewals, and determining eligibility. So throughout today's presentation, you may hear us reference both FSSA and DFR, depending on the context, of course, but now you know how they're connected and how they work together. Now that we've talked a little bit about the role FSSA and DFR play, the next question might be, why do they send so much mail? And the answer to this is that notices are a routine part of the eligibility and enrollment process, and they can be sent for many different reasons throughout the life of a case. So as shown here, FSSA may send a notice to, confirm an appointment was received, request additional information, remind someone that a renewal is due, or notify a household that their coverage has been approved, denied, or closed. Families may also receive notices if a change is reported or found in the household, like income, address, or change in the household size, or if benefits have been updated in some other way. Now, sometimes the notice is informational, while other times it may require action by a certain deadline. And that's why understanding how to read these notices carefully is so important to preventing delays, gaps in coverage, or worse yet, closure or termination of somebody's benefits. And again, this is really important, and I cannot stress this enough. Notices really do matter. They aren't just routine letters in the mail. They're one of the primary ways that families receive updates about their Medicaid or CHIP coverage. So now I'm going to turn to Collette, right, who will walk us through the types of notices that families might receive. And we're going to actually look at real notices together because our goal today is to help people feel more confident, recognizing when a notice is informational versus when immediate action may be required. So Collette, take it away.
Thank you, Bryce. I appreciate that. And again, as Bryce echoed, thank you, Anne, for the kind words at the beginning. Do appreciate it, and I do love what I do in helping families. So I believe working as a IHFA navigator, that one of the biggest challenges families face is simply understanding what FSSA notices are trying to communicate. In this part, we're going to see that some notices are informational, while others may require documents, updates, or a response by a certain deadline. We're going to walk through the more common types of FSSA notices related to Medicaid and CHIP coverage and discuss what families should pay close attention to when reviewing them. Because, like Bryce said, our goal is that by breaking these notices down into smaller pieces, that they'll feel much less overwhelming. One thing that can be helpful for families to know is that while FSSA notices may look different depending on the situation, there is a lot of common information that appears in most notices. For example, notices will almost always include a case number. There may be information about eligibility decisions, requests for verification documents, update to benefits, or instructions on what to do next. Notices also commonly include important deadlines and due dates that should be paid close attention to. Understanding where to locate this information within a notice can make the process feel much more manageable. So before we take a look at some actual examples of FSSA notices, I do want to briefly look at the consequences when notices are overlooked, misunderstood, or not responded to in time. Again, not every notice will require an action, but many do, and if action isn't taken, coverage could be directly impacted. When notices are missed, families may experience delays in application processing, interruptions in health coverage, or even loss of benefits. When someone is not completely confident about how to respond to a notice, it may lead to missed deadlines, incomplete submissions, or confusion about their coverage or eligibility. The good news is this can be prevented if we all work together to help families take simple steps like opening their notices promptly, reviewing them carefully, and responding as early as possible when action is required. Now, let's get into the fun stuff and start looking at common FSSA notices. Please keep in mind that every notice may look a little different depending on the situation, but most notices generally fall into a few common categories. Some notices are simply informational and provide updates about a case or benefits. Others are requests for information, sometimes called RFIs, where FSSA is asking for documents or clarification. Families also may receive renewal redetermination notices when it is time to renew Medicaid or CHIP coverage. A benefit closure or termination notice may be sent if coverage is at risk of ending, and benefit change notices can be sent to explain updates to eligibility or coverage levels. As we go through these examples, we'll talk about what each notice typically means and point out some key things to look for on these notice types. So let's start with one of the most common categories, informational notices. Informational notices are just that. These notices are meant to provide updates about a family's Medicaid or CHIP case and often do not require immediate action. Examples may include confirmation that an application was submitted, notification of a renewal redetermination, updates about benefits or policies, or information related to members' rights and responsibilities. Even though these notices may not require action, they are still very important to read carefully because they often contain helpful information about the status of a case, future actions, or upcoming changes. And I especially want to highlight our IHFA Navigator's pro tip at the bottom of the slide. Even when no action is required, families should still read notices in their entirety and keep copies for their records because having those notices available later can be very helpful if questions or issues come up with a case. Before we look at an informational notice, let's take a look at an envelope because there are important things you can see right away. First, you'll notice the words "attention needed" printed on the front of the envelope. There's an important clue that the mailing may contain time-sensitive information related to a Medicaid or CHIP case. You'll also see the official state seal, which helps identify the mailing as an official communication from FSSA. Another thing to point out is that these mailings are barcoded and case-specific, meaning the notice is connected directly to an individual or household case file. The barcode will go right underneath the return address. On our envelope example, you can see where we blacked out the barcode since it is case-specific, but that's where it would go right in the return address window. Next, let's look at an example of an informational notice. The example we pulled is a notice you would receive if a HIP application was just approved by FSSA. I know it's kind of hard to see the entirety first page of this notice, so I'm going to point out some key details and key information for this particular notice. At the top, you'll see several important and common details. First is the payee name, which identifies the primary individual connected to the case. You'll see the case number, which is the unique number assigned to the household or case record, and the program, which tells the individual which benefit program the notice is related to. In this example, it's health coverage. As we move into the body of the notice, the key information being communicated is that the applicant was approved for HIP coverage and explains the criteria met for that approval. The notice goes on to explain important details related to power account payments, or PACs, along with information about potential cost-sharing responsibilities. And this is where I want to pause for a moment because information related to PACs or these notices cause a lot of confusion, and I'll explain why when we look at the next slide. There should be an insert included with the approval letter that looks like this example. It's a yellow piece of paper, and it's very important to read this insert, and we have snipped key information taken from that insert. The insert explains that during COVID-19 public health emergency, Indiana paused cost-sharing requirements. It then goes on to say that HIP members continue to be exempt from co-payments and power account contributions. That makes things confusing is that the actual HIP approval letter contains a reference, power account contribution, and cost sharing throughout the notice. So from a member perspective, they may read the approval notice and believe they immediately owe payments or co-pays, while the insert just quietly explains that they are exempt from making these payments. So make sure you read every page in the envelope. Next, we're going to look at a second notice that people should look for a few days following the HIP approval notice. This notice would normally contain the same case details we reviewed in the first example, things like the payee name, case number, program, and mailing information. But for space purposes, we removed that section so we could focus on the content. This is another really good example of how FSSA notices can create confusion for members, especially someone brand new to HIP. Just like the previous notice, this letter repeated references PACs or power account contributions and talks about payment requirements for staying enrolled in HIP. However, because of that insert included with the mailing, we know HIP members are currently exempt from making a PAC payment. The notice says the member was enrolled in HIP Plus because your health plan received your fast track payment. COVID-19 also suspended the option of making a fast track payment. The notice also warns the new member that they need to continue paying PACs to keep dental and vision benefits, which doesn't make any sense because they are exempt from making a PAC payment. So right now, there is no risk of losing dental and vision coverage for any HIP member. Then the notice takes a lot of space explaining tobacco surcharges tied to PACs. And we know because PAC payments are not required right now, there is no way to add a surcharge. So all of that information just doesn't apply right now. So you can see that there's a lot of the information in this notice is just contradictory. And you probably understand why this notice would feel overwhelming and confusing for a HIP member. A notice like this can easily cause families to worry unnecessarily about payments, penalties, or losing benefits. So again, read every page in the envelope. Next, we are going to look at one more informational notice, an application denial. So the key information in this notice is that it clearly states that the application was denied. It also includes the date of the application was submitted. It explains why the app was denied, which in this example is because the applicant failed to provide all required information and did not submit proof of residency. The notice also provides the legal basis for this denial. And one really important thing to notice here is that missing even one document can cause a denial, which is why it's important to carefully read FSSA request for information. On this slide, we are looking at the back side of the denial notice. Here, FSSA provides information on how to appeal the denial. It should explain the different ways to file the appeal, by mail, fax, or through the local DFR office, and outlines what should be included on the appeal request: the member's name, case number, and reason for the appeal. It also provides local DFR contact information if additional assistance is needed. Moving on, we're going to look at a request for information. One of the first things families should look for in this notice is words like pending verification and a due date to return information and what information and documents FSSA is requesting. Examples of supporting documents should also be provided in the RFI. So you can see all that information is included in this example. The notice includes mailing and fax submission information, as well as the payee name and case number for reference. It says it's a pending verification for the applicant at the top, and it clearly shows the deadline for returning the requested documents, May 20th. It provides examples of documents that can be used to verify, in this case, residency and identity. I don't have an example to show you, but RFI notices should come with a document cover sheet. That document cover sheet FSSA provides is barcoded with the case-specific barcode. But as best practice, always put your name, date of birth, case number, and the last four of your Social Security on each and every page that you submit to FSSA. The next notice type we are going to talk about is a renewal redetermination letter. It's a big packet, so don't have to explain to share, but please keep in mind that this type of notice may both be informational and request of information. FSSA sends renewal redetermination letters because Medicaid and CHIP eligibility but must be renewed annually to make sure households still qualify for coverage. Not all renewal redetermination notices will ask for a return of information because some renewals may be completed automatically, but most do require that the member updates their information on a form, sign the form, and provide supporting documents. So, what information should you look for in a renewal redetermination notice? The notices will let the individual or individuals in this case know that it is time for FSSA their renewal to determine continued eligibility for Medicaid or CHIP coverage. Second, they may have to verify information or update information like household, income, or residency information. The notice will include instructions for completing the renewal and provide a due date. We actually covered Medicaid renewals in a much greater detail during the March Lunch and Learn. So if this is an area you like to better understand the renewals, you would like a refresher, we definitely encourage you to go back and listen to the session as well. And we will go ahead and drop that link in the chat for you. And please notice our IHFA Navigator pro tip. Always review renewal notices carefully because action may be required by a specific deadline. It is also important to keep copies of renewals notices and any submitted documents for your records. Next, we're going to look at a benefit closure notice. These notices inform individuals or families that Medicaid or CHIP coverage is ending or scheduled to end and explain the reason for the closure. Common reasons may include failure to complete the renewal, fail to return requested information or documents, or their income exceeds program limits. These notices are especially important because they will often include opportunities to continue coverage or appeal rights, as your pro tip points out. So here is an example of a benefit closure notice. This particular example is related to a redetermination that wasn't completed entirely, so their benefits will be discontinued. The notice clearly explains why coverage is being closed and says you did not submit all information and verifications necessary for the Healthy Indiana Plan redetermination form by the due date. It also points out that a questionnaire that was included with the original renewal redetermination notice was not signed and returned. One important thing to notice is that this letter also explains possible next steps. It tells the member that coverage may continue without interruptions if the information is submitted before a certain deadline, in this case, April 30th. And it explains that reinstatement is possible within 90 days if the individual returns all the missing information and is found to be eligible. It also includes important appeal rights and additional HIP-specific information on the flip side of this example. The last example we will look at is benefit change notice. This notice type lets families know that something about their Medicaid or CHIP case has changed, like a change in eligibility status, a managed care plan assignment or reassignment, a change in benefit level, or updates connected to a reported life change like income, address, or household size. So in this situation, a member's benefit level is changing, so FSSA is notifying them of that change. FSSA determined that the member is considered medically frail, which made them move from HIP plus coverage to HIP state plan plus coverage. The notice clearly explains that the member is now eligible for the reason for the change and the effective date of that change. It also includes contact information if the member has questions or needs to report additional changes. And just like many other FSSA notices, it reinforces the importance of reporting household or income changes during the eligibility period to help avoid future coverage issues. We hope to bring you a lunch and learn in the near future on what it means to be medically frail, so stay tuned for that. Hopefully, walking you through these real-life examples today helped make FSSA notices feel a little less overwhelming and a little easier to understand. The biggest takeaways I'd like to leave you with today is this: open your notices immediately and read the entire notice. Pay close attention to deadlines and don't ignore requests for information, even if you're not completely sure what the notice means at first. And at this point, I'm going to turn things back over to Anne to wrap up so we can get to your questions.
Thank you, Collette. It's a good thing you're a runner because you had a lot of words there. and a lot of information to get through. So yeah, thank you. We looked at a lot of examples and a few of them were a bit confusing, especially those HIP approval letters that talk so much about power account contributions, and then that enrollment letter that talked about tobacco surcharges. And we know from that little itty bitty insert that those are people are exempt from those. So thank you for laying that out. That was really good. We want to make sure that we leave you with key contact information and resources available. So if you need help or you're helping families get answers, you'll know how to locate local offices and receive support with Medicaid and CHIP questions or case issues. So on this slide, we have listed FSSA's contact information and a link to find a local DFR office. If you have HIP or Hoosier HealthWise specific questions, we have also provided you with the member services line for those two programs. On this slide, we have included the contact number for all the managed care entities, or MCEs. MCEs are health plans that administer Medicaid benefits for many Indiana Medicaid members, including HIP, Hoosier HealthWise, and Hoosier Care Connect participants. MCEs can be a very helpful resource for families. They can assist with things like finding providers, replacing insurance cards, understanding covered services, transportation benefits, pharmacy questions, and helping members navigate issues related to their health coverage plan. But most importantly, we really encourage anyone with questions or anyone assisting families with Medicaid or CHIP issues to reach out to our IHFA Navigator team. Sometimes even a quick conversation can help prevent delays, denials, or loss of coverage and help families feel much more confident navigating the process. As we've seen throughout this presentation, FSSA notices can sometimes feel overwhelming, confusing, or difficult to navigate, especially when dealing with those deadlines, verification requests, or coverage changes are involved. So our IHFA navigators help families understand those notices, respond appropriately, gather needed documents, and troubleshoot issues. And as we close and get ready to take questions, I really want to emphasize the important role that our IHFA community partners play in helping families maintain health coverage. Very often, families bring these notices to someone they already know and trust before they ever contact FSSA or a navigator. So that means community partners are often the first line of support. By encouraging families to ask questions early and connect with our IHFA team, you can help prevent missed deadlines, unnecessary denials, and gaps in coverage. This work truly takes collaboration, and we are incredibly grateful to our partners and the support that they provide to families across Indiana. If you are interested in becoming an IHFA community partner, or you would like more information, if you would like more information about our program or want to learn more about how we support organizations and the families they serve, please feel free to reach out to me directly. And I have provided my contact information on a slide somewhere that I'm trying to find. There we go. We are always excited to build a new partnership and collaborate with organizations that share our goal of helping Indiana families access and maintain health coverage. And then finally, back to that one slide I kept trying to show you prematurely. If you or someone you serve would like to connect with an IHFA health coverage professional like Collette, we encourage you to schedule an appointment with one of our IHFA navigators. And you can do that by scanning this QR code on the slide, calling our office, sending us an email, or visiting our website. So now I'm going to stop sharing, and we have a lot of time actually to take your questions. So I have stopped sharing.
You'll all see I have launched our post-session survey, a whopping 2 questions that we hope you'll fill out for us so we can collect that good data. I didn't get any questions during the session, but please now use that chat or Q&A function if you do have any questions about the topics that we've covered today, Or again, you're able to use the raise hand function and we can allow you to unmute your line to ask your question verbally.
And since we do have extra time and don't think your questions have to be FSSA notice specific, if you have just Medicaid or CHIP note questions in general, we're happy to take those too, since we do have some extra time. And then one other thing, I can always fill up airtime. If you have lunch and learn topics that you'd like to see us cover in future IHFA, IRHA presentations, please drop those in the chat. Again, our program, we directly work with families on Medicaid or CHIP. So again, if you have those Medicaid or CHIP specific topics, we'd love to take some suggestions. Collette mentioned we do plan to do one in the future on what it means to be medically frail. I know that's a question we hear a lot from our clients. So stay tuned for that. But we'd love to hear from you and try to align our topics with things that you're interested in.
And I'll just add a plug for Lunch and Learns as a whole. It doesn't have to only deal with insurance navigation and HIP, and we are always looking for the topics that are important to our critical access attendees. So if there's something that's keeping you up at night or something really wonderful you just want to share with your peers, please let us know about that as well.
And I do see a comment from Doris, who's a friend of mine. Thank you, Doris. Thank you for that compliment. I think you would probably agree, Doris, this is kind of uncharted territory. We've never done a presentation like this specific to FSSA notices, but I know that this is a very difficult part of the process to navigate many times.